Okay, so this is the equipment that I'm going to be taking in to see the patient with. This is separate from my own PPE, and it contains equipment so that I can take vitals on the patient. They don't always have their cardiocom in time for the first visit, but we still have to take a full set of vitals, especially because these patients usually have some cardiorespiratory disease to start with, and this COVID-19 disease state compromises that quite seriously. All right, so starting at the top, we've got a sphygmomanometer to take the blood pressure, a disposable stethoscope, a thermometer, oximeter, some alco wipes so we can clean the thermometer and the oximeter. The blood pressure cuff is a little bit harder to clean. I also have some wipes that I use, but I just don't have any at the moment. So I'm using some different wipes that I'm taking out of a big jar. There's also, with regard to my tablet, I have a disposable tablet cover on there so I can take the tablet in and record everything. You can't remember everything. A container, a very small sachet of hand cleanser, 2 bags to dispose of my gear, the white one to get rid of everything to start with, and then the red bag which has the hazard label on it, I put that into that, the white bag into the red one, and then that way I can just put everything that I use into those bags. So I pretty much set that up when I first come in. So, you know, as I'm, shedding gloves or shedding alcohol wipes or the labels off everything else, I can just throw it back in there. I think it's very important when you see these patients, although you're going to reuse some of this gear, you don't want them to recontaminate themselves, and superinfection is always an issue with them as well. So try to remember that. That's an important feature of looking after these patients. I've only had one patient that had a superinfection. I haven't had any patients that have had wounds so far, but I have had patients that needed their INR checked. So you might want to take in a spare set of gloves. I usually wear 2 pairs of gloves anyway, a disposable pair plus a disposable surgical pair. But this is basically what you're going to need to take in to see your patient and feel confident that you can get all the vitals that you can. Once the cardiocoms are set up, it might look like some of it's a little bit redundant, but we're not 100% certain if they're going to get another infection. The evidence at the moment is supporting reinfection because we're dealing with a virus and it hides intracellularly, so we can only measure what's outside the cell. With regard to